Welcome back to Breathing for Better Sleep with Dr. Fred Egg. Today's episode explores one of the most under-discussed but life-changing conversation in sleep medicine. What if deep sleep isn't just about rest, but about protecting your brain from dementia, memory loss, and long-term cognitive decline? More and more research shows deep sleep plays a massive role in brain cleaning, memory repair, emotional reset, and long-term brain health. But if your airway isn't stable, you may not be getting enough of it. Let's unpack what really happens. When you look at the connection between poor sleep and dementia risk, how real is the link, Dr. Eck?
Well, it's very real. It's one of the largest correlations we have in all of medicine is that between having a sleep disorder and developing memory issues like dementia and Alzheimer's. If you look at the prevalence of certain forms, like Lewy body dementia, 90% of those dementia patients have sleep disorder. Right? If you look at Alzheimer's amongst all the categories combined, it's nearly half of those patients have a sleep disorder. So, it's not just the hype. It's a real thing.
And people think of dementia as genetics or aging. How does sleep, especially deep sleep, enter that conversation in a meaningful way?
There are a few types of dementia that are known to have a genetic component. They're the more rarer forms, but most are lifestyle and other risk factors. A lack of deep sleep is hindering the brain, essentially nightly cleaning and memory consolidation processes. This allows toxic proteins like amyloid and tau to build up, leading to cognitive decline and neurodegeneration. And when we're looking at sleep tests, we'll talk about this a little bit later on, but when we're looking at sleep tests, the AHI number that everybody looks at, how many times do you stop breathing per hour? It's the most useless number on a sleep test. The numbers that are important are things like, what is your percentage of deep sleep? What is your percentage of REM sleep? What is your oxygen doing? And so if anybody gets a sleep test and they're not measuring for their stages of sleep, then they should request a new test because these are very important numbers.
Have you seen patients whose memory, focus, or mental clarity improved dramatically once their sleep and breathing improved?
Oh, yes, this happens all the time. It's very important to know this is not just about sleep apnea. I know everybody's talking about sleep apnea, but all sleep disorders that create fragmented sleep affect the stages of sleep. Upper airway resistance syndrome essentially has the same effect and can have the same effect on our stages of sleep, but this is something that's almost always ignored by most people. If you take a sleep test and your AHI, your number of times you stop breathing per hour is less than 5, it's considered quote unquote normal. Well, no, you got to look at a whole entire sleep test to determine if something is normal. It's got to get above a 5 to have sleep apnea, but you can be below a 5 and have several other sleep disorders that can create the same problems. So we can't downplay or ignore these other sleep disorders or even mild sleep apnea. You know how many times I see a report from a doctor that says, it's just mild sleep apnea? What do you mean it's just mild sleep apnea? This is like downplaying stage 1 cancer. If you get told you have stage 1 cancer, most people don't take that like it's good news, right? Most people take that like crap, shoot. Because we know stage 1 is going to turn into stage 2 and then stage 3, right? So you don't just ignore it because it's stage 1. We shouldn't ignore sleep apnea because it's mild, because it will progress.
Yeah, I guess sleep apnea is sleep apnea and it should be treated. It's not normal. It's an imbalance. It's happening in the body, right?
The other side here is just look at how sleep and treating sleep disorders has been shown to improve ADHD in kids. The longer it's ignored, the sleep disorder, even in kids, the more permanent the cognitive deficits are. It makes me sad when I see parents bring their kids in and they choose not to treat their kid's airway problem. That kid who today is 6, 8, 10 years old, who seems very smart, sometimes even almost gifted, they're getting cognitive deficits by their sleep disorder that may not show up until that child is late in high school or in college when they have to learn harder materials. Studies on improved test taking, they're out there, based on improved sleep. We can't ignore REM sleep. Okay, we're talking about a lot of deep sleep today, but it's not all about deep sleep. REM sleep is important in processing and storing memories. So there's studies that are done that show that test taking is improved by improving REM sleep. So we can't ignore the REM sleep either. Okay. But yes, it definitely, you can see these patients turn around and just feel more clarity and improve pretty rapidly, actually.
So lack of REM sleep or deep sleep really does generate a learning disability, just because you can't store memory in the same way that you would if you were rested, right?
Yes.
And for the average listener, what is deep sleep really doing inside the brain that's so important?
Well, so when it comes to these memory issues and cognitive issues, in layman terms, what I say is your body produces a protein every day called amyloid protein, right? It accumulates around your brain. And then every night during deep sleep, your body clears that away from your brain, flushes it away essentially, right? Well, if you don't stay in deep sleep long enough, you don't flush it all away. So then what happens? It accumulates. And one of the tests we do to test for these memory diseases, right, like Alzheimer's, is an MRI looking for those proteins on the brain. There's a thing called the lymphatic system, which is essentially the waste clearance system, which is the technical way of saying what I just said. During deep sleep, the brain's lymphatic system becomes highly active, flushing out metabolic waste, including these amyloid and tau proteins linked to Alzheimer's. Memory consolidation. Deep sleep is crucial for processing and storing memories, transferring them from short-term to long-term. So a lot of times, again, with REM sleep, we're looking at some short-term memorization and memory things, right? But the deep sleep is the process of converting those to our long-term memory. Insufficient deep sleep allows these protein levels to rise, contributing to brain damage and cognitive deficits.
And where does breathing stability fit into all these? How does airway collapse interfere with the brain's ability to reach and sustain deep sleep?
Airway collapse contributes to and causes fragmented sleep, which means fragmented sleep is you're not going through your normal sleep cycle. So you don't end up spending your proper amount of time in REM sleep and in deep sleep. But the airway collapse causes repeated blocking of your airway, which can then result in apnea and hypopnea events, which drops oxygen levels and triggers. And when that oxygen goes down, that triggers arousals or brief awakenings, okay, so that your body can restart breathing, preventing you from reaching the deep sleep, because deep sleep comes later in the cycle. So if you have these events, it may never let you get all the way or stay asleep long enough before you have an arousal to get to that deep sleep. And that's what you need for restorative sleep, okay? These constant interruptions make your sleep non-restorative, leading to daytime fatigue, poor concentration, as your brain and body can't cycle properly through those stages. I mean, you should spend as an adult 20 to 25%. If you want to be the healthiest you can be, when we're talking about cognition and brain function, between 20 and 25% of your sleep should be in REM sleep, and 20 to 25% of your sleep should be in deep sleep. Now, younger kids in general, these percentages fluctuate. Some of them are higher, and they get a little lower as we get older.
It naturally gets a little lower, but that's that should be fine?
Yeah. So you might go from a kid spending 30 to 40%, but then they go as they become an adult down to like 20%, 20 to 25%. Anytime I see deeper REM sleep under 20%, I want to try to get that above anytime we can. And, a lot of times parents will come in and they're like, well, you only stop breathing. AHI is 5, right? You only stop breathing 5 times an hour. What do you mean you only stop breathing 5 times an hour? If somebody walked in and choked you or your child 5 times per hour for at least 10 seconds, and some of them going, let's say, 45 seconds, would you consider that normal? That's what's happening. Your body's choking.
And does that activate the sympathetic nervous system, survival mode or fight or flight, because the body feels like it's choking, so it stresses out in order to survive and be able to breathe again? Or not at all?
What's triggering that fight or flight or sympathetic nervous system is as you're choking, essentially, and not breathing, the oxygen goes down. And eventually the oxygen deprivation is what triggers that fight or flight to arouse you to make you breathe.
So it is stressing the body, and that's why there's a lot of hormone imbalance as well when you're not sleeping properly, right? It's not just the lack of sleep, but also the fact that it's constantly triggering your sympathetic nervous system.
Yes.
And you've said before that many people think they sleep through the night, but they're really just surviving fragmented sleep. What kind of micro arousals quietly destroy the brain recovery?
I believe what most people are meaning by that, and what most people, the term that would be probably most appropriate for that, are what we call RERAs. RERA apostrophe S. RERAs are often ignored on sleep tests. But RERA stands for a respiratory effort related arousal. It's a subtle breathing disturbance where the body struggles to breathe. You get an increased respiratory effort. And just like an apnea or hypopnea, it has to last 10 seconds to count. But in this struggle to breathe, you still get an awakening or arousal, which causes fragmented sleep. Okay. Now, the RERA does not meet the same criteria as a hypopnea or an apnea, because a lot of times with these RERAs, you're going to get the fragmented sleep or the altered stages of sleep, but what you don't see with them is the big drop in oxygen. So to count as an apnea or hypopnea, you've got to get that drop in oxygen. So a lot of people ignore the RERAs, and when it comes to what we're talking about in the stages of sleep, they can have the exact same effects. And when you look at that AHI number, where they take the number of apneas and hypopneas and divide it by the amount of time you sleep to get that number on that scale, right? Well, what's left out of that? What's not included in that is RERAs. And I'll commonly see, especially with kids, you'll see not a lot of apnea or hypopneas, but a lot of RERAs, which causes the exact same effects.
Dr. Eck, could you clarify what a hypopnea is? Hypopnea? Is that how you pronounce it?
Hypopnea.
Hypopnea.
So an apnea means you stop breathing for at least 10 seconds. Okay. What's funny is if you stop breathing for 8 seconds, is it any different? No, but that's ignored on these scales. That's why these AHI scales are useless. By the way, they were never designed for clinical use. They were designed for research and statistics. Insurance companies started using them, and that's why they're used, but they are pretty much a useless scale. The AHI includes both the hypopneas and the apnea. So apnea, by definition, means you stop breathing. There is a cessation of breathing. No breath going in, no breath going out for at least 10 seconds. A hypopnea is at least a 30% resistance or reduction in breathing. So it's not a 100% no breathing. It's a restriction in breathing by at least 30%, but still causes that oxygen drop.
The apnea is you stop breathing for 10 seconds, and hypopnea is a reduction in 30% of the breath coming in or out, but for a determined amount of time as well, like for 10 seconds, let's say, or or just throughout the night?
Yes, in order to count, it has to be at least 10 seconds. Okay. And it has to reduce oxygen, or it has to be at least a 30% reduction, right? It could be a 90% reduction of resistance, but it doesn't count as an apnea unless it's a 100% restriction in airway.
Okay. And people assume I'm snoring, but I'm fine. Like how dangerous is that mindset when it comes to, we're talking about brain longevity. So how dangerous is to ignore snoring?
You have to realize if we're snoring, it's often the first sign of airway resistance or a collapse in the airway, right? It goes back to what I said earlier, ignoring stage 1 cancer, right? Ignoring snoring is like ignoring stage 1 cancer. If you snore, you should have a sleep test done, right? Because if you snore, then usually one day you will have hypopnea and apnea events. Even if you're not having them today, it will progress, okay? But it's very important to note, not everyone with a sleep disorder, not everyone with upper airway resistance or sleep apnea snores. So you can't say, I don't have a sleep problem because I don't snore. Snoring just happens to be a very common sign and oftentimes the very first signs. But you don't have to snore to have a sleep disorder.
So you don't have to snore to have a sleep disorder, but if you snore, you do have a sleep disorder, or you are very close to developing one?
You have the first signs. It's kind of like pre-diabetes versus diabetes, right? You have signs of airway restrictions, right? And you may not have full-blown sleep apnea. You may have upper airway resistance or fragmented sleep, which creates all the same problems as sleep apnea does, medically.
But it will always be an indicator, correct? Like you've mentioned before, sleep is not normal, so you couldn't say, "Oh, I'm snoring and I'm completely fine."
The only way you know is to have a sleep test done. So if you snore, that's a sign you have airway resistance, and you should have a sleep test done. That's the
And
only way you know. How do we know if we have high blood pressure? We test it. How do we know if we have high blood sugar and diabetes? We test it, right? The only way to know if you have a sleep disorder is to do a sleep test. And if you have any of the signs or symptoms, and snoring just happens to be one of those.
okay. And how early should we start caring about this? Is it something that we should concern us once we're adults, like later in life? Or do you wish people in their 30s, 40s, and 50s were already thinking about protecting their brain through having good sleep, through getting tested, through caring about sleeping properly?
You should start before that. I mean, if we have these things going on, we should look as early as possible. Because at any age, even in very young children, you can create fragmented sleep. You can create oxygen deprivations, which can just have long-term effects. If we look at an MRI of a moderate to severe sleep apnea patient, the MRI of their brain looks like a dementia patient. I know a doctor. I was listening to a doctor once who was telling us a story about his brother. His brother developed dementia at a very young age, like early 60s, right? They happened to have an MRI of him when he was in like his late 30s or 40, right? Because of another medical reason. They had an MRI of his brain. And now, knowing what we know now in these MRI evaluations, do you know what he did? And this guy's a neurologist, by the way, who treats dementia and Alzheimer's. Right? He went and looked at the MRI from his brother, and this MRI is like 25 years old. And he saw the signs starting back then that he would see in a dementia patient. Okay. And so he was an untreated airway patient. So it takes years for this to develop, for us to become symptomatic. When you wait till you're symptomatic, I don't want to say it's too late, because you can still get improvement, but it's too late. I mean, you've let it get to this point. It doesn't need to get there.
Wow, that's so interesting. So What would be a more silent sign, for example, then? Like for those patients who don't snore and think they don't have a sleep problem or an airway issue because they don't snore. How can these people prevent getting there? Or what are the
There's
signs?
there's lots of signs of that we look for. And one of the things that we do when I lecture, when I coach doctors or go into and help doctors learn to implement screening for sleep into their practices, there's lots of things we show them to look for, right? That are the patient may have symptoms. They may have chronic allergies, chronic nasal problems. They may have ear issues, vertigo, tinnitus. A lot of these are signs that are very common in conjunction with airway issues. But there's things that don't create symptoms. Like you take a child who has crowded teeth. You have somebody who clenches or grinds their teeth. They have what's called scalloping of the tongue. There's lots of signs and things that we can look for if we just do a screening and pay attention to it.
Now, I also feel like there's a lot of people that suffer like from fatigue and they think it's like a hormonal issue or no burnout, but it could also be a sign that you're just not sleeping properly. Am I
You
correct?
said they suffer from what?
Fatigue.
Fatigue. Oh, yeah. I mean, the fragmented sleep is, you can sleep 10, 12 hours, but if you're not getting enough deep and REM sleep, then you're still going to be tired.
And I think that a lot of people keep this information to themselves because they feel like they're lazy or
A lot of it is that, but a lot of it is just, th- our airway problems, our snoring, our daytime fatigue, which is just becoming more and more common, especially in young people. We're starting to, as a society, just normalize it. And it's not normal. It's not normal to walk around tired all day. It's not normal to sit there and yawn all day. So we're just getting to the point where normalizing this stuff, and that's the wrong way to go.
yeah, it's absolutely not normal to be relying on coffee to have energy all day.
Mhm.
And if someone is noticing forgetfulness, mental fog, or emotional irritability, how often do you see sleep and airway behind that instead of just aging?
The majority of the time, the answer to this question is real simple. I always say to people, show me somebody with these issues that has a normal sleep test. And when I say normal, not just talking about the AHI, I'm talking about stages of sleep. Are you in parasympathetic mode? If you're not, if you're in sympathetic mode, that means your heart rate's getting above 75 beats per minute when you're sleeping. Okay, what is your oxygen doing? All of these things, not just that AHI number. Show me a normal test without any of these other things being off. It's hard to find somebody with these issues that has a normal sleep test.
Okay. And so, can improving sleep breathing generally change someone's long term brain health trajectory or at least slow down a decline?
Oh, absolutely. And this is again what we talked about earlier. I mean, we know the improvement in the brain and the brain function based on improvements in ADHD and anxiety and depression and all these other things by treating sleep issues and fragmented sleep. But you have to improve the breathing in a way. This is a very, very, very important point. You have to improve the breathing in a way that also improves the fragmented sleep, right? I'm going to talk a little bit about CPAP here because it's the go-to standard for pulmonologists. And they always want to say it's the most successful treatment for treating sleep. And I 100% disagree with this because I find very few people who come in and we do a sleep test on them with their CPAP in place. Yes. Is their AHI number down? Yes. But is that a successful sleep test? Not if we're talking about what we're talking about today. Okay. If your goal is to improve cognition and deep sleep, your CPAP is normally not your solution. This is very, very important when it comes to defining successful treatment. I'm going to talk about a lady that we saw several months back. She spent the last 10 years of her life taking care of her husband, who ended up with bad dementia, right? And she's like, I don't ever want to develop this. I don't ever want to put my children through taking care of me like I just had to take care of my husband, right? So she gets a sleep test done. The pulmonologist gives her a CPAP. He tells her it's working perfectly because her AHI went from whatever it was, a 10 down to a 2, right? But she had two chief concerns that made her question whether the CPAP was working. One, she was still snoring. And secondly, she was still getting like some brain fog and stuff during the day. So she questioned whether it was working. So she attended one of our seminars and she came in for a test. And I don't care whether you're wearing an oral appliance, going through epigenetics, you do a surgery, you wear a CPAP. Once you're done, you should be doing an updated sleep test with that in place to make sure it's actually working and looking for more than just the AHI scale. So we have this lady do a sleep test, and in the 2 or 3 years, 2 years or so that she had been wearing the CPAP, her doctor never had her get an updated sleep test with the CPAP in place. They just assume it's working. As most doctors do, they give you a CPAP, they assume it's working. Okay. Well, we had her do a sleep test. Her deep sleep was almost 0. It was like 2% with her CPAP in place. Okay. So this is very important because one of the things I've noticed over the 20-something years of treating these sleep issues is when somebody wears a CPAP mask, their deep sleep most of the time is worse with the mask. Because the mask, just the irritation of the hoses and the mask and everything else, can pull you out of deep sleep and create fragmented sleep. So I rarely see somebody's deep sleep get improved by wearing a CPAP. So for her, even though her AHI went from 10 to 2 and under 5, remember, is considered quote unquote normal, is she being treated successfully with this CPAP mask? No. She's still snoring, and her concern is preventing dementia. And if the mask, without the mask, by the way, she was at like 14%. With the mask in place, she's 2%. So is it doing what she wants? Is it preventing dementia? No, it's not. So when we look at defining success of treating breathing disorder, we got to make sure we're looking at the whole test and not just one number.
Again, I'm going to ask about the snoring, but I think that it should be really clear for people because I think that a lot of people do ignore it. So if you are being treated for sleep, for example, with the CPAP, and you're still snoring, you're not getting better.
You might get it better, but is everything resolved? Probably not. Because if we're snoring, we still have a resistance somewhere, right? Only way you know is to get an updated sleep test.
But snoring, snoring does mean there's inflammation, or the air is having a hard time getting in.
Correct. There's restrictions in the airway for snoring.
And what are the warning signs that someone might not be getting restorative deep sleep, even when they sleep 7 to 8 hours a night?
Well, this comes back to number one. Are you snoring? Right? And then there's all kinds of signs we talked about earlier that we coach doctors on paying attention to, because these are all signs we look for, such as grinding our teeth, what we call restless leg syndrome, chronic ear issues. A child with chronic ear issues needs ear tubes. They got an airway problem, okay? Crowded teeth in kids, bedwetting in kids, adults having to get up multiple times a night to pee, open mouth posture. You have a kid walking around or just sitting in the back of the car with their mouth open. That's a sign of an airway problem, okay? Asymmetries. Is one eye or ear higher or lower than another? Posture. Is one shoulder higher or lower than the other? These are all signs that point to we can have an airway problem. That they in themselves, each sign may not have a symptom with it. But if you start looking at somebody and they got more than one of these signs, you should have an airway test.
And how does restless leg syndrome look like? Is that while you're sleeping or before you fall asleep, when you're in bed?
It's while you're sleeping. So when your oxygen drops, it can create two physiological responses. One is teeth grinding. Okay. The other one is what we call restless leg, where our leg will literally flex or kick, okay, while we're sleeping. And you know about it because your spouse complains about you kicking them, or you literally wake up with sore legs, right? So that is a common problem when we have oxygen deprivation.
That's so interesting. I've heard it before when I was younger. I can't remember, but it was kind of like a common thing, like, oh, I don't like sleeping with this person um, because they kick at night. And I always thought that it's just because some people just move a lot, but it might actually be what you're saying.
Yeah, it could actually be restless leg syndrome.
And even for kids, that happens.
Yes.
And before we close, Dr. Eck, what's one thing you wish every person understood about protecting their brain with their sleep?
Sleep is critical. You can live a long time without food. You can live a long time without water. You cannot live a long time without oxygen. There are many studies on sleep deprivation and health. A lot of studies that in today's ethical guidelines you couldn't even do anymore. Those with sleep apnea have a 500% increased chance of having depression or anxiety disorders. It's a huge number. It profoundly affects our mental state and our brain. So getting the proper we're not talking about oxygen deprivation today. So outside of the oxygen deprivation stuff, the fragmented sleep and stages of sleep creates a huge impact on our brain. So I would just leave with that. It's just sleep is critical. We know how important it is. It's just something that seems to have been lost in medicine and now seems to be making its way back.
I feel like we should get to the point where there's regular testing just for anyone, like a regular checkup on sleep, just how you get a blood test every year, that it would be required to get or normalized to get a sleep test every year.
If there are any signs that we talked about that somebody could have an airway problem, they should. I mean, when you look at the fact in today's world, half the population, 50% of people have one sleep disorder or the other. And if you have these sleep disorders, it is leading to a lot of the medical conditions that we're spending all of our time and money treating. 70 and 100 years ago, when we had a focus in medicine and actually had schools that were putting doctors out focusing on prevention, okay, then airway was a thing back then, and treating airway and paying attention to airway. But once we went away from prevention into what Western medicine is today, reactive, okay, well, treating sleep can be reactive, okay, but when you're treating sleep early on, it's preventative. And that's the problem with Western medicine today. The preventative aspect has been lost.
Yeah, it just vanished. And in my case, for example, I just can't ignore the fact that when I've felt very fatigued in my life, and I'd go to the doctor, they would send me to an endocrinologist, and then they would try to focus on my hormones, but nobody ever thought, okay, how's your sleep? Should we check that?
I mean, of all doctors, by the way, of all doctors, one of the doctors, so if you screen in a doctor's office, every patient that comes through with a little verbal screening and a little exam, and let's say a general physician's office, you're going to end up with 30% of people screening positive with these simple screeners that we have, right? But in an endocrinology office, it's typically over 50% because these people all have hormone problems, right? So this is the other reason why deep sleep is very important. Deep sleep is a stage of sleep which your body regulates hormones. So if you're not staying enough time in deep sleep, Everything in your body is controlled by one hormone or another, right? Blood sugar, blood pressure, cortisol, all the things that people are going to the endocrinologist to treat. Of all people, an endocrinologist should have every single patient tested for sleep.
Absolutely. And I do think that that should come from the doctor, like you mentioned, not from the patient, because a lot of people don't know how to tell if they're having a good sleep or not. Because in my opinion, or in my experience, when you ask someone, do you sleep well? Do you sleep properly? They're like, yeah, I sleep for 8 hours. They think that the time that they spend in bed is the time that you're sleeping. But now, as you've told us through this episode, you can be sleeping or like in bed for 7 and 8 hours. And if you're not rested, sleep is not functioning the way that it should be. It's not repairing, it's not restoring. So, but a lot of us don't know how to identify that. So doctors should be the ones picking up on this, should be the ones, oh, hey, no, if you're sleeping 8 hours and you're still tired, then you're not sleeping properly. Let's go get tested and address that before we look into anything else.
Yeah, before we start writing prescriptions for meds, we should be looking for the cause of why we need the meds. And, but in Western medicine, that's not how we do it by most doctors. And if you would do that, you could actually help wean people off medications and prevent medications. And start early, you could put somebody goes to our website on the pediatric page, or you could also put the link to that in the show notes. But we have a screening questionnaire that's on there for parents to fill out about their kids, right? And if you go through this and you end up with a number of yeses, then your child has an airway problem, most likely.
Well, we've reached the end of our episode, Dr. Egg. Thank you so much for everything you've shared with us today. I'm looking forward to our next episode. And for all the listeners, that is it for this episode of Breathing for Better Sleep. Deep sleep isn't just about feeling rested. It may literally be protecting how you think, remember, feel, and function for the rest of your life. If you or someone you love is noticing memory changes, brain fog, or mood shifts, this conversation might be more relevant than you think. Share this episode and visit sleeptreatmentdirect.com to learn more about restoring the kind of sleep that protects your brain. Better breathing, better sleep, better brain.